Okay, so this video is going to be on suctioning. And suctioning, we're going to cover all 4 quadrants and the various ways that you as an assistant can help hold the tongue out of the way, hold the cheek out of the way, suction, of course, the saliva in the water, and keep the mirror clean all at the same time. So let's go through some videos that we have actually filmed live with a patient, where I am, of course, running the handpiece, and the assistant is going to be running the suction. So let's just go through here. Here's the upper right. And so you're going to see where I'm located, and I'll be starting and stopping this video as we go. But if you notice, I'm over here. I'm holding things out of the way. I'm looking, from this angle down. And the assistant, she's in here with the mirror. She's helping to protect the, I'm holding the mirror. And she has her air water, and she's blowing air on the mirror, keeping that clean. She also has her suction. The big suction is pointed back here. So it's in the very back corner of that upper right quadrant. And so just kind of watch as we're working here, the mirror is being kept dry right there. And then the suction is just staying in place. Notice how she's not jumping around. She's not moving the suction from one puddle to another puddle. She's just kind of staying right there. She's also making sure that the tip of that instrument, of the suction, isn't actually jabbing into the gums or into the cheek. Okay. Let's see, what's the next one? Okay, this kind of also shows how we just kind of all come in to the site all at the same time. And it's just kind of more the same. I just switched up the burr. And again, same thing. She's just making sure that she's looking at both of those. Now let's go over to the upper left. Very similar. Again, with the air water, she's keeping the mirror nice and dry. And she has the tip of this, again, way in the back. I'm working on this tooth up here, but she has the suction way in the back. Because remember, of course, the patient's sitting back, the water is going to puddle back there, and so that's where she's going to be suctioning up the excess water. And so you just kind of see, again, same story, not really moving around. May go in there and just do a quick little spot there, and then if you saw she moved over to the other side, it kind of catch some water that was building up on that other side. I'm washing and drying. I'm sorry, she's actually washing it, drying it, and cleaning it while I'm switching out a burr or cleaning off my mirror, and then I'm going right back at it, and same thing. Cleaning off the mirror. Well, maybe not right now, but okay, there we are. Let's see, a little bit different case. Going to, same patient actually. Now notice this time the saliva ejector is in, not the high speed, not the HSV or the high speed evacuator, but instead it's the saliva ejector. So just a different way of doing it. Still working on the upper left quadrant. So you can mix and match different kinds of suction depending upon what might fit best for the patient. Also notice, though, that as I'm working, she's going to make sure that her air water tip or whatever going to be the suction tip of some sort is not going to be either in my line of sight or is going to be in the way of where my drill is going. So the head of the drill isn't going to be bumping up against any of those suction tips. And so again, she can just move around different spots, making sure, again, it's not going to be interference. You can tell we're very close right here, but she's just right out of the pathway of this drill head, knocking that suction tip. Okay, let's move on to, should be something else. Yeah, kind of more of the same. Now look, she went back to the high-speed evacuator and actually going to the other side of the mouth. And still, amazingly, not interfering with the drill, or even with my ability to see. She's not in my direct line of sight. Now I may switch spots and switch my position, and she's just going to move, her suction tip around so that she can still continue to do her thing, suction up the excess, and then of course allow me to do what I need to do. Okay, should be going on to another quadrant here pretty soon. Okay, there's kind of some of the same. Again, cleaning off the mirror and doing the high-speed suction off to the side, way in the back, allowing me free access to do what I need to do and keeping the patient comfortable the whole time. Okay, let's see, what's next? Kind of still a little bit of the same. Now switching back to the saliva ejector and then just holding the cheek out of the way. And let's see here. It's still kind of the same quadrant. And look at this. The saliva ejector is now on the other side of the mouth and still has the air water ready to go to clean off the mirror whenever necessary. Okay, now we are in the bottom left, lower left, and the saliva or the high-speed evacuator tip is way in the back. She's actually holding the cheek out of the way with the air water to kind of give me access to protect the lip while I'm in there with the mirror holding the tongue out of the way. Now switching over to the saliva ejector, we have the triangle in there. She has the air water tip holding the cheek out of the way so that I have access to get down there with my drill on the lower left. This is, of course, assuming that the doctor is right-handed, which 90-something% of the dentists are. If it's left-handed, it would just kind of be a flip-flop and be a mirror image the other way. Also, that right there, see how the patient just stop for a second? When I come out of the mouth, she may go in with the saliva ejector and have the patient quick close just to get that last little bit out. You have some patients, though, they close and they stay on it for a long time. We want to make sure that we don't do that a lot because that can really interrupt the flow of a procedure. But a quick little reset for the patient is always a nice gesture. Just want to make sure we don't do that too often. Otherwise, it makes the procedure extend way longer than it needs to. So again, saliva ejector tip in the back, not allowing it to puddle. Remember, the patient is laying back. The camera, of course, is right on top of the patient during this filming. And here we're in the last quadrant, the lower right. And let's just take a look at what's going on here. You have the assistant has the mirror handle, or the mirror is holding the tongue out of the way. The saliva ejector is way in the back again, collecting, or where the water seems to collect. That's where the suction is going to be occurring. And remember, she's not jumping around from side to side chasing puddles, just kind of staying right there. And here again, just see how that just kind of slid that right in. Well, almost. Let's try it again. Okay, her mirror, my mirror, saliva ejector is going back. I guess I skipped the mirror. I'm just going to hold it with my finger, which is typically not what you want to do. You want to not keep your fingers in the mouth with moving instruments like that. But here you can see, again, making sure the patient's soft tissues are protected while we're going in and trimming up the hard tissues, that being the tooth. Here, look at this. It's a combination of actually the saliva ejector and the high-speed evacuator. Sometimes you can put them in together at the same time, and that works too. Put the saliva ejector away, using the mirror to hold the tongue. Again, not moving the tongue or the mirror too far back, causing the patient to gag, just making sure the tongue is not going to accidentally go over to where the drill is. Saliva ejector then going down there a little bit deep, but again, not stabbing the floor of the mouth or the tissue just on that tongue side of the gum line, just keeping it in a nice, comfortable spot. And that is it. That's how we do the quadrants. All right. We'll see you on the next video.